swelling.
Oh, yeah.
You know, I was so happy that it was.
No, yeah, I don't know if it can get much lower.
I know it. That was good. That was really good.
This is it. This is graduation day. See how my results are.
Wrist flexion. Alright, and your wrist flexion. $60.
Okay.
That's nice. And that's good. Well within functional limits.
Awesome.
Going back into wrist extension. 50. The
50.
last time it was 40. So
40. Wow.
yes.
Really?
So 10 degrees better there.
Wow.
And we're going to go to the side. We're going to go into ulnar deviation. So let's go this way
this
first.
way.
Yes. Go into ulnar deviation. And you've got 40.
Okay.
Which is very good. Very good. We did functional limits. And radial deviation. We're going to go the other direction. Good. 20. And it was 15 before. So
Oh, wow.
too. Very nice. When you first started, you had a lag of you had an MP extension lag, but now go ahead and straighten up. You can see you're completely straight. We don't have to measure because you're completely neutral. You had a lag before from all the scar tissue that was adherent through there.
So right in there, that's where all the tendons kind of got tied up a little bit.
That's exactly right, because they all go into underneath the retinaculum there, which is like a ligament that covers the tendon, and they got stuck in there. But you pulled through that, and that's why you have a nice, loose, supple scar. It's not adherent. You can see there's no puckering when I move it. It just glides. And all the tendons underneath there are gliding well too, which is why you can completely straighten. First visit, you had a pretty significant lag of your extensors because they were just caught up in there.
I wasn't able to get it up all the way. Oh, wow.
So that's good. Now the next. Now we're just doing a little bit of passive range of motion.
Okay.
Which is excellent. Definitely within functional limits there.
I noticed, like even when I do this at home, whenever I'm stretching it, like how you're stretching it now, downwards, and I go to lift it up, like I'll feel like the bones in my wrist kind of like crack and.
Yeah,
you know,
and it's hard to change positions.
Like right away, like I have to go easy on it. You know what I mean?
Yeah. Well, that makes sense. But you think about it, like say you're watching TV and you're sitting in one position. Even in a normal wrist, if you go to move it the opposite direction, it's gonna hurt. This is still healing.
Yeah,
so,
absolutely.
Yeah.
Okay.
So that's pretty. Pretty common.
Okay.
That'll go away though.
Okay, good.
Most of the things you're feeling are gonna go away in probably 8 months. Maybe a year to feel 100%.
Okay. Yeah. Absolutely.
But just really, really good gains in there.
Like, did you feel that crack right there?
I did. But see, I think too what you're feeling is your carpal bones are shifting in there now.
Okay,
They're finding their new home, you know, so they're kind of shifting still because they're not in the same place that they used to be. So your joint capsule is remodeling around the new shape of your wrist.
Okay,
And you do have a new shape of the wrist because things are missing and the other bones are kind of now moving into their new home. So, and your joint capsule is remodeling around that. So, that's what you're feeling. You know, as long it's not painful though, right? Is it a painful?
Just a little bit, like a little pop, but I mean, it's not anything that, oh my gosh,
No.
it just, and I've noticed that pain, it's gotten less and less, so it's all part of the healing process. And but yeah, I mean, that's really, I'm trying to think of anything else I have a question about. I think that was the only thing
How's this pain right here? Because you had some radial styloid pain here.
Getting a lot better, yeah.
Okay, good. So
it doesn't affect me nearly as much.
Okay, good.
And,
good.
I feel it whenever you go like that.
When I go in.
Yeah.
Well, sure.
But as far as going the other way, I don't feel it on the other side.
No.
And it doesn't give me any problems whenever I'm at the gym or anything like that. The only thing is I feel those tendons on the side of my wrist.
Right
Right through there. That's it.
Okay.
And that's whenever I do the biceps and stuff.
Okay, and that's what's in heavier.
Yeah.
Load. How about weight bearing? How are you doing?
Oh, weight bearing is fine.
Okay.
Yeah.
Good. That's
Yeah.
one of the last things to
Yeah, because, I've been bench pressing quite a bit, so,
okay.
yeah.
And without a brace or anything?
No, I've been wearing a brace.
Okay.
Just, kind of hold everything together, but, but I can bench without a brace on, yeah.
Okay.
It doesn't give me any problems.
So now we're just running a little ultrasound.
Okay.
And we have it now. At first, when you first came in, we had it in a pulsed mode for the inflammation.
Okay.
Okay, and by pulsed I mean it just causes like a little micro vibration in there. But now you're further along, inflammation's down, so now we do it on a continuous mode, which is more thermal.
Okay,
so,
yeah. I feel it's a lot more hot.
Yes, exactly.
Yeah.
So it's more of a thermal, and that's so that we can get more flexibility.
Okay, cool.
Yeah, so we kind of change it as you progress, but the inflammation definitely resolved, so now we want to do more of a deeper heat.
Yeah, okay.
Now this is just a soft tissue mobilization.
Okay.
We do it, 1, to loosen up all your muscle and fascia, 2, to get rid of swelling.
Okay, yeah.
We've done that from the beginning to just kind of work out the swelling.
And as far as my recovery, how do you think it's been since
Accelerated.
Yeah.
I think you're way ahead of schedule.
Okay.
Way ahead of schedule. Now you're young. Very, very.
That plays a big factor too. A lot of people that have this procedure are a lot older.
Yes, you're very young.
Yeah.
I mean, and very, very motivated.
Yeah.
With a high pain tolerance, I have to say.
Yeah.
I do
Okay.
believe. I think all those things kind of played in your.
Okay.
Your
Yeah.
favor. I mean, it made me have to reel you in a couple times.
Yeah.
But in the end, I think that's what made you progress so quickly.
Okay.
Yeah.
And now, what's the normal range of age-wise that you see that have this?
Probably 50.
50.
I've seen a lot of 50-year-olds. I mean, I'm not saying that some haven't been younger. Between 40 and 50. I've probably seen the most of the time that I've seen the PRCs was old scaphoid injuries that never really healed.
Okay.
Well, and then caused a lot of problems later on.
Okay.
So they were like maybe a football injury where the scaphoid fractured. They might not have even known they had a fracture, and then it just never healed right. Because the scaphoid's a bone that often is missed. There's a missed fracture.
Oh.
Okay, so then they have a fracture. They don't realize that later on they get a collapse. You know what I mean? The scaphoid ends up.
Yeah. Just like my lunate, this is a different whole,
Yes, exactly. But yeah, I've seen that for also for the ligament that attaches the scaphoid and the lunate. When there's a problem there, a lot of times they'll take out the proximal row.
Yeah.
So there's so many different reasons why they take it out, but you know, this is not a common problem, but I've seen it a handful of times. But usually when people have Kienbock, it's kind of the same presentation. It kind of comes on. People don't really know what's going on.
Yeah.
They just have this dull aching pain that they cannot figure out why. I mean, one guy was a postal worker. He was in his 50s. He had Kienbock. Didn't even know it.
Yeah.
And just kept going for x-rays, being sent to therapy for tendonitis.
Yeah.
Until the MRI was done, and then it just... It was a different color than all the other, all the other bones.
Yeah, it's definitely tough. Now, it's been about what, 3 months? You know, what's the normal recovery rate that you've seen? How long?
Usually about 4 to 6 till people can really get back to doing heavy stuff.
Okay.
Yeah. So that's why you're a little accelerated in that. But once we were able to safely do strengthening, you just went with it.
Yeah.
You know, that's the thing. Once we were able to safely do the strengthening at that 8-week mark is when we started the first few weeks. You were sent here, I think, what, 2 weeks post-op?
Yeah.
And so we were mostly focusing on motion.
Motion and swelling.
Motion, swelling, and scarring. And then at 6 weeks, we started the submaximal isometrics, where you just, you know, a little bit of resistance and kind of without moving the joint. And then 8 weeks is when we really started to start with the isotonic PREs and really work through that. And that this past month, I've just seen from like 8 weeks to 12 weeks.
Okay, yeah.
That's when you really took off.
Yeah, right.
Do you agree?
Definitely, yes.
Yeah.
I agree.
From 8 to 12 weeks, you took off.
Yeah.
You know, and again, I think you got really good at monitoring your pain, too.
Yeah, well, I think part of it is, you know...
And respecting your pain.
Yeah, right. I think, you know, because I put up with Kienbock for 2 years, and that pain was, you know, a lot more than what I'm getting now.
Right.
So just being able to tolerate that.
This is our scar pump.
Okay.
I'm just going to do a little scar retraction.
Now, why is this good for the scar?
Because what happens is after, especially on the back of the hand, when they do any kind of surgery, the skin starts to adhere. The scar and the skin start to adhere all the tissue below, like the fascia and the tendons and the bone. So what we do is we just try to kind of
separate it.
And lift it up.
That helps with your bladder.
It helps it like kind of lift up off the underlying tissue, because the skin, how we can tell if it's adherent is whenever you try to move it, it'll pucker a little bit. But his is really good. It was adherent before to everything. Everything was just all glued together, because there's just not a lot of there's no fat there, so there's just no play, and it just all starts to kind of glue together. They call it like one wound, one scar. It just all just glues together. And then this is our Dyson. We just kind of use it to mobilize the skin too. Back and forth. Circles. Just make sure everything's moving freely.
Okay.
And this is just simple Dyson. That way when we try to move the skin, it's not like rubbing over it, it's actually holding the skin and mobilizing it. And then this is our skin sensational brush, and it just does the same kind of thing. It's like a rubbery material.
Okay,
just go and mobilize the skin that way. And all around it.
Yeah, and I noticed that I'm hairier wherever like I grow hair wherever I feel like the pain. You know, like how I complained about whenever I'm doing biceps, like I get pain up in here.
And
that's where I'm getting hair. I'm actually growing hair there, and you know, and like here.
It's where it's trying
stuff
to
like
heal
that.
the most, and
Yeah.
usually that's where there's like more blood flow, more circulation. They call it a trophic sign, and where you have the increased hair growth is where that's particularly where you're getting more healing.
Yeah. Okay.
And that's kind of what happened with you, is, and other patients that you've talked to too, that where there's the hair is where there's more
Yeah.
more healing that's going on.
Okay.
But
Yeah.
that'll thin out too.
Yeah, I'm happy. Well, I'm happy to see that because that's where I have most of my issues when I'm doing biceps and stuff is
Yeah,
right in there, and
right there.
the hair's growing, so at least it's going to
working.
improve.
It's
Yeah.
healing.
Yeah. So
Yep.
that's cool.
All right.
Yeah,
I think that's it.
Come a long way.
Yes, good patient.
Well,
Very
thank
good
you.
patient.
Well, hey, you had to reel me back in, and I learned a lot coming here, and I've had phenomenal results. So.
Good. Well, good. And I'll check in with you later on in the week to see how you
Okay.
return to work.
All right. Thank you.
You're welcome. Yeah.